Ciment at the Chel Foot and Ankle Center in Manhattan. I wanted to spend a few minutes with you today and speak about a very common skin infection that affects millions of Americans, athlete's foot. Athlete's foot infections are caused by a fungus, usually something called Trichophyton rubrum, but that doesn't really matter. The salient features of this kind of infection is that people start to notice a little bit of an itching or a scaling on the bottom of their feet. Often people will come in and say, oh, I have calluses on my feet, which are in fact not calluses, but a little vesicular eruption, a little bit of a skin rash that actually causes the itching and the irritation. If it's left untreated, these can actually make their ways over to the different nails on the different toes and eventually give you the dreaded toenail fungus, which causes your nails to get thick and yellow and unattractive. So it's really important to be sure that you get rid of an athlete's foot infection when you have it. Unfortunately, for a lot of people, they don't even know they have it because sometimes this is not accompanied with itching. So it's really important that you check your feet every single day and make sure that you don't see any kind of abnormalities on the bottom surfaces of your feet. If you do, start using a regular over-the-counter moisturizing cream like Jergens or Vaseline Intensive Care, Eucerin, whatever works for you. If you notice that you're not actually getting that sort of dry, scaly skin to disappear, it's probably a good idea to have your podiatrist check it out and make sure that you don't actually have a subacute athlete's foot infection that doesn't cause itching. Athlete's foot is very simple to treat, and there are a lot of homeopathic and natural remedies on the internet, but the only proven and tested way to actually get rid of it is with prescription-strength antifungal medications. These are topical treatments that you put on, that your doctor can prescribe for you. It is a very, very simple thing to do. Usually 2 applications a day, 1 in the morning, 1 in the evening for 4 weeks, and the infection goes away if you take care of all the other environmental contaminants. So it's really important that when you do this, you clean out your shoes. And by cleaning them out, I mean if you have a washable sneaker, throw it through the washing machine. If you have any other kind of shoe gear, boots, rollerblades, running sneakers, open them up, take a can of Lysol disinfectant spray and get inside the can and really spray into the shoe until it's a little bit damp. This helps to disinfect the shoe and make sure that any of the residual fungus is not actually in the shoe, waiting to just reinfect you when you put it on the next time. I tell people that while they're in the course of disinfecting their feet, they should go ahead and actually spray their shoes after each use. A big place where people are picking this up are in yoga studios and in gyms and other health clubs. One of the things you can do in a gym or a swimming pool or a health club locker room, make sure that you always wear flip-flops. And sort of kindergarten rules are the mainstay of the treatment. It's sort of, if you touch it, you're it. It's the same kind of thing. Even if your foot in a sweat-dampened sock just sort of touches the bottom surface of the gym locker room, you could have actually just contracted athlete's foot and brought it into your shoe. So I tell people to take an extra towel, put it on the ground, and then change your shoes on that extra towel so that nothing, your shoes, your socks, your skin for certain, never touches the surface at the gym locker room. And then of course, when you're using flip-flops to go into the shower and out of the shower, it's important that you bring them home almost daily and spray them out with some sort of bleach-based disinfecting spray. Athlete's foot is a very, very complicated infection to get rid of if you don't have the right tools. But under proper care and proper guidance, your podiatrist can help you and get rid of this infection for good.